coming speaker, دكتورة نورا نبيل, radiology تتفضل, and she will be discussing what is behind PET-CT in variable granulomatous diseases.
Good morning, dear colleagues. Today we are going to discuss what is behind PET-CT in variable granulomatous disease. PET-CT helps differentiate malignancy from granulomatosis conditions by detecting increased metabolic activity in both, but its primary role is in assessing malignancies rather than definitely diagnosing granulomas. Concluded that SUV measurements was not useful in characterizing lesions. However, in countries and regions where infections are not endemic, the probability of malignancy in association with positive PET-CT is high. Let's discuss different FDG appearance pattern of the two major granulomatous diseases like the TB and sarcoidosis and their mimics to malignancies. By examples. First example here, pulmonary tuberculoma in a 59-year-old man, as you can see here by the blue arrow, a nodule in the right lower lobe with high FDG uptake, observed on the axial CT images and in the PET-CT. It mimics malignancy. However, by the diagnosis by biopsy, it is a tuberculomic nodule. Another example, PET-CT in 61-year-old man with TB, a mass in the right lower lobe observed on the axial CT and the intense uptake by FDG, it mimics lung cancer also. Axial and sagittal set image are also axial PET-CT in 45-year-old woman with tuberculosis, smolydoschitis, and associated with vertebral bone destruction. Another example by the TB in a 47-year-old woman showing tuberculosis involving the lungs and also the brain and also the meninges. Axial CT and axial PET image on the coronal PET with tuberculosis pericarditis, we can see slight uptake FDG in the pericardium and also the parahyarid lymph nodes. Okay. Standard treatment duration for simple pulmonary or lymph node TB without resistance is almost 6 months. Currently, response to treatment in patients with positive TB is monitored principally by bacteriological examination, whereas responses in patients with negative TB are usually monitored clinically or radiographically. PET-CT for TB scan can assess early treatment response when neurological features may remain unchanged, with FDG PET-CT at 2 months demonstrated 96% sensitivity for predicting treatment success and 79% specificity for predicting treatment failure. Difference. Patients with non-cavitary tuberculomas may have no symptoms and their cultures may be negative. Imaging with PET-CT may help. If the lesion shows a decrease in the activity, tuberculoma is likely response to anti-TB treatment. If the FDG demonstrates an increase in the lesion activity, then another current treatment regimen should be considered. Another example here, FDG PET-CT scan before anti-TB treatment and 2 months later after treatment. As you can see in the picture number 8, the map here, we can see extensive disease, including the lymph nodes, axillary, mediastinal, hepatic involvement, pulmonary, abdominal lymph nodes, inguinal. After treatment response, as we can see here, there is a complete metabolic response of pulmonary and right humeral lesions at the pelvic and inguinal lymph nodes. Let's discuss another common granulomatous disease like the sarcoidosis. What about sarcoidosis? The goal of sarcoidosis here management are to prevent or limit organ damage and improve the patient's quality of life. The differentiation of reversible granuloma disease from irreversible is very important. In these settings, FDG PET is useful for evaluating the presence or the absence of active inflammation that indicates reversible granuloma. As you can see here, cardiopulmonary sarcoidosis diagnosed at lung biopsy in a 48-year-old man. A and B A CT image and follow-up B CT image obtained. As you can see, as regard the radiological finding, there is a stationary appearance of the involvement of the lung bilateral higher lymph nodes in the receptor thickening. But in the MIP here, as you can see, there is active inflammation by the increased FDG avidity. This finding promoted additional treatment. Here, this means that is an active disease. If we can take treatment and follow up, we can see decrease in this avidity. Another example, chronic pulmonary sarcoidosis in 70 years old woman. As you can see, an axial CT scan image show a pre-hilar mass-like consolidations. Axial FDG PET show the FDG uptake to be less than the blood pool, which means it is not an active, means it is a reversible fibrosis. Another example, systemic sarcoidosis in a 70 years old woman. A and B axial pre-treatment CT. A and FDGP scan show prominent partially calcified lymph nodes seen in the mediastinum, in the hilum, in the left internal mammary region, with increased the FDG avidity. Axial post-treatment scan show that the lesions are stable in size and appearance at the CT, but have decreased in the uptake in FDG, which means that is a favorable treatment response. Systemic sarcoidosis in a 35 years old woman. A on the axial CT image, it's difficult to assess involvement of the bones and non-enlarged lymph nodes. In the B axial pre-treatment fused FDG PET CT shows hypermetabolic lesions in the sternum, in the clavicle, in the lymph nodes here, and in the axillary lymph nodes. After treatment, fused FDG scan show nearby complete resolution of these hypermetabolic foci. Thank you.
شكرا يا نورا على المحاضرة اللطيفة دي. أحب أقول لكم إن نورا يعني أنا كنت مشرفة عليها في رسالة الماجستير من زمان جدا، والحمد لله إنها يعني لقطت الحب المسح الذري وانضمت بعد كده لينا يعني. فأنا بحييها على المحاضرة اللطيفة دي، ويا رب كده دايما تفضلي تقولي لنا حاجات حلوة. دلوقتي بقى دكتورة هبة النجار أختي الصغيرة واللي مسكت من بعدي وحدة